Hi everybody, Dr. Ahles here. In this short video, we're going to talk about why it's important for a person to know their blood type in the context of getting a transfusion and also in the context of a mother's pregnancy. When we talk about getting blood transfusions, typically the reason that these will be done is for things like hemorrhages, which is a very large bleeding, something like you would see with a car accident, for example. But we also use blood transfusions to help treat anemia. So when someone's red blood cell count is low, perhaps because they're making faulty red blood cells or because their diet is low in iron, those kinds of things. We also use blood transfusions to help people who are immunosuppressed. So if they're receiving treatment for cancer, we may use a blood transfusion to make sure that their immune system has what it needs to function. When we think about blood transfusions, it's very important that you receive a compatible blood type. What I mean by a compatible blood type is there are certain kinds of blood that if a donor gave it to you, your body would be totally fine with it. There are other kinds of blood, though, that if your body gave it to you, if a donor gave it to you, your body would completely not be okay with it. So let's look at our table here. When we're talking about someone who has type AB positive blood, remember from our discussion on blood typing that someone that is AB positive has A antigens, B antigens, and the Rh factor on the surface of their red blood cells. Someone who has the A antigen can always receive blood from someone else with the A antigen. Someone who has the B antigen can always receive blood from a patient with the B antigen. And if you have if you're positive for the rhesus factor, Rh, that means you could receive either the positive or the negative version of different blood types. Now, for someone who is AB positive, their red blood cells have every possible antigen on the surface, which means that any of these types of blood that we see up here, the body's going to be like, yeah, that's probably fair. It should be in my body. Let's compare AB positive with all three of those antigens on the surface to O negative. Remember, if a person has type O blood, they don't have any A antigens, they don't have any B antigens. They have 0 antigens, if you will. And if someone is O negative, that means in addition to not having A antigens or Bs, they also don't have that Rh factor. Someone who is O negative is going to have antibodies for everything. They're going to have antibodies for A because they don't have that, B because they don't have that, and that positive, the Rh factor. So if your blood type is O negative, the only kind of blood that you could receive when you're in the hospital is O negative blood. Because if we give you O positive blood, you'll react to that Rh factor. If we give you A blood, whether it's positive or negative, we're going to react to that A antigen or the B antigen. When we talk about blood transfusions, here are 2 blood types I want to make sure that you know. First type that I want you to know is type O negative. We talked about how if someone is type O negative, it's really hard for them to get a transfusion because their body doesn't recognize so many different types of blood. But because type O negative blood doesn't have anything on the surface of the cells, no A's, no B's, no Rh, notice how these individuals who have this kind of blood can give blood to anyone. So O negative is considered the universal donor. You have nothing on the outside of your red blood cells, anyone can receive your blood. Compare that to type AB positive. If you're type AB positive, on the surface of your red blood cells, you have A antigens, B antigens, and positive antigens. Everything that could possibly be on the surface of these red blood cells, you've already got it. So your body doesn't care. We call AB positive the universal recipient because you can receive any type of blood and have no problems with it. Now, as you look at this chart, we can see that different kinds of blood can be given to different kinds of people. You could memorize this chart but I would suggest that you don't memorize it. What I want you to do when you see problems like this on the homework or a quiz or exam, I want you to think about, with the blood type you're starting with, what antigens are on its surface. So for example, if I'm talking about A negative, the antigens on my surface is just the A antigen. Whereas if I'm A positive, I also have that Rh antigen. Now I know what I do have, which means anything else that would be on the surface of my red blood cell, like a B antigen, for example, or, and if we're talking about A negative, that Rh factor as well. If I don't have it on my cells, you can't give me blood that does have it. Because if you give me blood that is incompatible, meaning it has something on its surface that my body doesn't like, my body inside of me is going to do agglutination. Now, agglutination is what we saw in those petri dishes for the blood typing. You add serum that has antibodies that attach to things that aren't normal. Well, if you give me the wrong kind of blood, my blood will have antibodies that are going to attack it. And if this occurs, we have what are called transfusion reactions. So transfusion reactions come in 3 varieties, but all 3 of these are an indication that you gave me the wrong blood type. My body is attacking it. So the first kind of reaction you could have if you receive the wrong kind of blood is an allergic reaction. So if it's a slight allergic reaction, we might see things like flushing or hives. But as that reaction becomes more severe, we might have issues with bleeding, or our blood pressure would drop because we're having this major allergic reaction. Another kind of transfusion reaction we could have is called a febrile reaction. And in a febrile reaction, the first thing we'll see is fever. A very severe fever as your body starts to attack these red blood cells that don't belong. Along with that, we start to see things like chills or a headache, and soon our breathing rate and heart rate are way too fast. The other kind of transfusion reaction we can have is hemolytic. And remember from our discussion of hemolytic anemia, this means we're actually breaking down red blood cells. Those red blood cells don't belong. I'm going to start chopping them up. As I do that, my blood pressure is going to go down. I don't have as many red blood cells circulating. My respiratory rate will go up because I'm not getting enough oxygen throughout my body. Any of these kinds of reactions are an indication that you received a type of blood that is incompatible with you. There's something on those red blood cells that yours don't have, so your body is attacking them. So the first reason we need to know about blood types is to ensure that when someone receives a transfusion, they receive the right kind of blood. The other reason we want to know blood typing has to do with something called hemolytic disease of the newborn. Hemolytic disease of the newborn is something that can only occur, let's underline, highlight, star, in Rh negative mothers. If a woman is Rh negative and she's pregnant, there is a chance that the antibodies in her bloodstream could attack the developing fetus. This can only happen if, let's underline, highlight, star, that fetus is Rh positive. Now let's remind ourselves what Rh negative means. Remember that means there's no Rh antigen on the surface of mom's red blood cells. And if she doesn't have it, her body would make antibodies against it. Now, this doesn't typically happen. It's not typically a problem with a first baby, because when a mother is pregnant with her first baby, the placenta blocks the movement of fetal red blood cells into the maternal bloodstream. But during the process of birth, when an Rh negative woman is carrying an Rh positive baby, in the birth process, some of those fetal red blood cells mix with the mother's bloodstream. And when they mix with the mother's bloodstream, she'll start to make antibodies against that Rh antigen. So Rh negative mother, Rh positive fetus, we start to develop anti-Rh antibodies. Now, when the mother becomes pregnant again in the future, she has circulating around in her body anti-RH antibodies. So if her next developing fetus has a type of positive blood, those antibodies can cross from the maternal circulation in through the placenta and get to the fetus's red blood cells. And when that happens, we see this hemolytic disorder. Red blood cells will start to be destroyed. So, when we're thinking about what causes hemolytic disease of the newborn, we don't send antigens back to mom from across the placenta. She gets exposed to antigens during birth. When she's exposed, she starts to make these antibodies that in subsequent pregnancies can cross the placenta and lead to issues in the fetus. This is why we see something used called the RhoGAM shot. The RhoGAM shot is something that can be administered to a woman during her first pregnancy or beyond. The RhoGAM shot is something that neutralizes those RH antigens. So if a mother is RH negative, she'll often receive a RhoGAM shot early in her pregnancy, and then as she gets closer to birth and right around the time of birth. The goal of that shot is to make sure that we don't make any of those RH antibodies, so that future pregnancies, we wouldn't have to worry about the mother's antibodies affecting her developing fetuses.